Hello everyone, welcome to my channel. In this video I'm going to talk about anxiety disorders. Myself Dr. Mika from Homeopathic Clinic. If you are new to our channel, please do like and subscribe, and don't forget to press on the bell icon so that whenever I put a new video you will be notified. First we will be exploring what are the really kind of anxiety. Do you really need an treatment or you just want to neglect it? Because some people say that anxiety is just a myth, it's just an fear, there's nothing to worry about and there is nothing to be taken treatment of. But it's just not true, because anxiety is a disease which is really means you cannot even predict how severe the anxiety can get through in a person, because anxiety is the patient's mind is having so much of fear that they will always be in fear, and there is no happiness or no calmness in their mind. They will be always in an anxious mode. Anxiety disorder is a what is anxiety disorder? Anxiety disorder is a mental health condition characterized by persistent and excessive fear. This is the note should be taken. Persistent means you are getting fear at one point of time, means you saw something which was unusual and you got feared for 1 week, it's okay. But for 1 month you're getting feared and you did not see anything, it is persistent, then you should be taking the medications. That is the anxiety disorder. There are three types of anxiety disorder. Types of anxiety disorders: social anxiety disorder, fear of being judged in social setting, means if the person who has to go for some function, he has to attend some function, he get anxiety that time, that you can go for social. Next one is panic disorder, means sudden episodes of intense fear, means the patient will be sleeping and he gets up and he starts to get panic. That time it happens during the night or during the morning or during some usual times, or if he is going for exam he gets that panic attack like that. Okay, moving on to the causes and the risk factors. Causes are, once it is genetic, rarely I'd seen genetic, because in genetics it is not 10% you can just take. Traumatic life events, that is the major factors, like 90%. Chronic medical conditions, this also 10%. Substance misuse, this is just 1 or 2%, that's all. Major thing is something which they are going through, means due to some trauma from their past life or from their childhood life or from the incident which has happened with their parents or home incident like that. First we'll be knowing on symptoms of anxiety. What are the symptoms is restlessness, this is one of the major symptom. Feeling on edge. Rapid heartbeat, means palpitation or shortness of breath, the patient will be unable to breathe. Difficulty in concentrating, because of that they cannot concentrate on anything. And muscle tension, for some people will be there, for some people it will not be there, but the major symptoms of anxiety is restlessness and a rapid heartbeat and shortness of breath. I'd seen in so much of patient, because the patient says that I cannot breathe, I think there's something wrong with my lungs. They see this kind of symptom, they does not say that I have anxiety, I have fear like that, I have fright like that, no. Okay, moving on to the which are the different age groups where this kind of thing happened. Previously there was much more symptom which is seen in the old age people, means in the ancient times, but now on today's lifestyle it is different, because everyone is facing, even children, even teens, even old age people, everyone, every age group is been facing, because there is change in the lifestyle, there is change in the environment, there is change in much things. Because previously the children used to not get this anxiety, because there was so much of people around them when they come home, and they used to interact and they did not know about it. But nowadays there is no people, and there is a rule like this, if if parents wants the child to do this thing, they have to do it. That is the rule. But previously it was not like that. They used to just leave them to live their life like that. Okay, moving on to the homeopathic treatment, how homeopathy helps in this anxiety disorder, which are the medicines which are helpful in the treatment of anxiety disorder, and which are the best remedies for the treatment of this anxiety. Some may be thinking, does really homeopathy work on this kind of thing? Seriously, homeopathy works as a magic if it is works, because it is really a magical medicine. Once you take it, once you experience it, then only you will come to know how magical it is. Okay, first one is aconite nepalese. Acute anxiety with tremors, means the patient gets up and says that no, I felt like this, and there is a body movement also, and there is also tension in the muscles in the aconite nepalese people. And they also have, whenever they have this anxiety effect, they have fear of death, and there is frequent palpitation, and you can see that palpitation with the eyes only. The patient is very restless and inconsolable, means the patient cannot control himself, means the person who is beside him will be saying that no, there is nothing, don't worry. He will be unable to listen. Next one is arsenical, intense anxiety with great restlessness, fears something terrible will happen. He is worse during the night and after the midnight. This is specific. Very chilly patient, and always the patient will be fault finding patient will be there. He is always a timid kind of thing. This patient will be having so much of palpitation, and they also have this kind of means they will feel like, okay, if I touch this I'll get some disease, and like that kind of anxiety is also there. Anxiety of diseases is there, anxiety of cleanliness is there. Next one is borax, anxiety leading to nausea with fear of downward motion. Borax people always have the fear of downward motion. They cannot go downstairs. They cannot. They can climb up the stairs, but they cannot go downstairs. He is first until 11 p.m. This is one of the specific time modality of the borax. Borax people will be always feeling like, okay, whenever they are up and they want to go downward, they feel this anxiety effort. That is the anxiety attack when they get in the borax people. You should be able to differentiate which remedy for which people you should be giving. Next one is Bryonia alb, anxious about business even through seriously ill, means they will be, even when they are not well, they are having fever, it is almost 104 105 like that, but still they will be thinking about their business. Oh, it's not kind of working out, I should work for that. And he will be anxious about his business, not about his disease, because if he leave only he can lead that business, right? But for him the business is very important than his life, like that he will be there. Anxious about business even though seriously ill. This is the specification for anxiety of Bryonia alb. Next one is Karpovich. Anxiety is worst felt lying in the bed with eyes closed. This people also have the gastric complaints when the anxiety starts. This is one of the concomitant symptom of the Karpovich. Means if you're looking for a Karpovich for anxiety people, you should just confirm that they have the gastric symptoms or not. Anxiety is worst felt when lying in the bed. When they are in the rest position, they have this anxiety thing, and when they close their eyes also, this kind of anxiety happens for them, means they cannot breathe and there is difficulty. They feel the abdomen is so heavy and they also feel so much restless to lie on the bed like that. Next one is causticum. Anxiety worst in the evening due to the means the patient will be having an reception to attend in the evening, but he cannot go because he has that kind of fear or the anxiety sets in. Because of that he also goes into the diarrhea like symptoms, and he may also go into the UTI, means urinary tract infection may happen for them when they know that in 1 week there is a function they want to attend, or incontinence of urine. This I had seen much more in the causticum people. Anxiety which leads to the urinary problems. In carbovage the gastric problem should be there. In causticum the urinary problem should be accompanied. Next one is gelsemia. Anxiety due to fright, fear, emotion, or any kind of exciting news, or there is an exam coming. Because of that also they have this fear, and any kind of interview they want to attend, or there is an exam in 1 month, the exam is coming near by near, the anxiety starts. Because of that they cannot concentrate, and because they cannot concentrate, whatever they read, that thing is going inside. There is an interview, they are unable to prepare because of the anxiety effort. That time there is so much of palpitation, restlessness, trembling and all is there. Dizziness, drowsiness is also seen because they cannot sleep and all. That time you can give gelsemia. Next one is ignatia. Anxiety due to grief, because ignatia is given for the depressed people. If you are thinking of ignatia, that person should be depressed, that's all. That thing should be there. Okay, because of the grief this patient has developed the anxiety effort. Means someone has died, means her husband has been died, or for the husband the wife has been died, or they had disappointment of love, or loss of any family members who they was loving or dependent on them so much, any kind of thing. Next one is lachasis. This lachasis is given in the nocturnal attacks of anxiety, means for the children's anxiety effort. Means cramps in the legs, and also cramps happen because of the anxiety and the fear. Lachasis people does not get affected by anyone. They feel like they are the superior, they does not fear for anyone like that. But in the children's there is an fear, but in the teens and all you cannot give, because if that person is lachasis, they does not have any kind of fear. They will be like, I am the boss, there is no boss above me, like that. Lycopodium. Anxiety with lack of confidence. The patient is unable to sleep due to the happening during the day. Anxiety about the forthcoming event. This is also kind of same as the gelsemia. Lycopodium patient have so much of social anxiety. Means I had said 3 types of anxiety, right? In that first I said social anxiety, that is for lycopodium. Means they does not want to go. They have this kind of anxiety because I had seen so many people. Means they will be all prepared, they are very intelligent person, but they cannot go outward and they cannot give their speech. That because of that they also have this anxiety, and ARS sets in, or nervousness or sweating sets in. Next one is natremure. What is natremure? Anxious about everything, even have anxious dreams. Means the patient gets up from and dream very anxiously, sweating on the forehead, and nervous, trembling, sweating, everything will be there. Natremure patient is very sweet, but they're anxious about everything, they're nervous about everything, the fear is always there, and these persons are also kind of depressed. They want everything according to them, and they have this kind of feeling like, I'm not going to tell anything, but you should find out that and you should do for me. If that does not happen, they just sit in one room, close the door, in a very dark room, like that. Phosphorus, very restless patients who are sensitive, they need security and constant reassurance, and they're always anxious, restless, nervous due to the fear of darkness, thunder, alone, or die. Because the phosphorus patients are very extroverts, they cannot be alone, they want one or two people around them, they should be keep on talking, like that. And they also have fear of darkness, because the phosphorus is like that. And during rainy season also they have this kind of anxious, and they are very sensitive, and they are very kind of cool people. Pulsatilla, is always weeping. Bad news, emotional upset, VP. Anxiety after bad news or an emotional upset, the patient is very VP, twitchy, and needs a company. This is one of the peculiar symptoms of the pulsatilla, because the pulsatilla always need consolation. Who does not need consolation is the aconite people, because when there is an anxiety attack, when you go, the patient is inconsolable and restless. But here in pulsatilla, when they are anxious, they need the consolation, means they want someone to be there, and they want someone to be saying something for them, like that. Next one is sepia, anxious towards evening, and they always wants to be alone, indifferent to those loved ones. This is one of the peculiar symptom of the sepia, means they will be very much indifferent to their loved ones. Like for her husband, she acts as if she is very cruel, but for someone who means husband's brother, she is very okay with him, means she cooks the food. When the husband says that I need a coffee, she does not does a coffee, but when someone asks, she does it, like that. She's very indifferent to the loved ones, and it only happens when they when they are disappointed. Sulfur, anxiety is worst felt in the morning with profuse sweating, and also they also likes to faint also because of that sweating. This sulfur patient have so much of anxiety, because they feel like whatever they do, whatever they know, it's right. When opposite person says no, you're wrong, this is not the way, this is like this, when they put the fact in front of them, they cannot agree on that. Even if it is true, they know that it's true, but still their mind says that no, I am the correct, I am the boss, like that. So because of that, the anxiety issues happen, breathlessness and restlessness and sweating happens. Next one is calcarea cow. This is one of the most given remedy for the anxiety. Because of that, I am keeping it the last. The patient thinks that he has done something wrong. He feels uneasy, anxious with palpitation, fears loss of reason, and they also have the fear of life, fear insanity, makes others bored by repeatedly describing about the elements, means about the cause why they have this fear. Even without doing anything wrong, they feel they have this kind of myth that they had done something wrong, and because of that they are anxious. If someone says that you're not done anything, why are you getting so much of worried about, but they say no, this has happened, because of that, that will happen, that will happen, this will happen, like that. So they are very irritable, but they are also sweet. I hope I was helpful for the healing of anxiety disorder. Myself, Dr. Megha from Homeopathic Clinic. I am a practitioner from 5 years, and homeopathy is a real healing. It heals from within. It does not have any kind of side effects. It is always beneficial for the patients who really wants to get cured. If you're looking for an homeopathic treatment, just go for it, because don't have any doubt, does it work or is it really a myth, or